PreOp Clearance right now. I'm about 2 weeks out from my cranio-spinal fusion and decompression surgery. So since this process was something I had a lot of questions about, I thought I would kind of track what I've been doing. I'm actually exactly 2 weeks out from surgery today. Christmas has been a really great distraction since it happens a couple days before my surgery, so I've just been focusing on that, but the surgery is really sneaking up on me. However, I do have my PreOp clearance done, and I just wanted to kind of go over that a little bit. So my surgeon has your primary care physician do your PreOp clearance. So they sent a ton of paperwork, and then my PCP has been doing that process. I actually started this process a couple weeks ago. I wanted to meet with my primary care doctor and just make sure all was well for her to take care of this instead of waiting until a couple weeks before and then her being like, oh, I can't do that. And so I met with her and she said it was totally fine. She put in orders for all the blood work I needed, but she also requested that I go see a cardiologist for PreOp clearance because my heart has been a problem, which is not required by my surgeon. But to be safe, I went to the cardiologist, and I had an EKG done, which came back very abnormal. So they sent me for an echocardiogram, which I had done a couple weeks ago, and the results have came back, which obviously I read on like my chart, which also were a bit abnormal, but I have an appointment coming up in a couple of days to check back in with my cardiologist about that. I am pretty sure that they already cleared me for surgery, regardless. But I do need to wait until that appointment in a couple of days to make sure everything's good to go. Basically, the way I'm looking at things right now is there are some heart issues going on for sure, but we believe that this surgery should help a lot of my heart problems because my brainstem's being compressed. It's responsible for your autonomic systems. There's a chance that it could be the brainstem compression that is causing some of the autonomic failure and some of the problems with my heart. So I'm hoping that this surgery clears up a bit of the heart problems. But if not, I do plan to, after surgery, find a really good cardiologist. If any of you know of a cardiologist on the level I need, an EDS-friendly cardiologist, I would be super grateful for recommendations. Willing to travel, and I'm on the East Coast. But anyway, so my PreOp clearance has to be done 30 days before your surgery. My surgery is the 28th of December, and I was advised to do it earlier in that 30-day period because if anything was wrong, it gives you a bit of time to fix that before surgery. So I did mine right at the start of December. So they sent me for a metabolic panel, a pretty typical one, but then there was also a screening for your cortisol levels, which is not in the typical pre-op process. So I had to have a separate blood draw done for that one, but all of my blood work came back okay enough. My surgeon had sent me for a micronutrient panel through Vibrant America several months ago, which revealed that my body was deficient in a lot of the micronutrients. So my primary care physician actually added those to my metabolic panel. Most of the ones I was deficient in are weird ones, so my lab can't actually test for them, but the ones they can test for, like vitamin D, for example, she added to this screening to kind of see how I'm doing with those levels. And then the final one was just like a urinalysis, and then I also have to have a COVID test done at the hospital, and I'm just having that done the day before, so my surgery is on the 28th. I'm going to go down on the 27th and have the COVID screening at the hospital, and then just stay overnight near there. So yes, I have spoken with the hospital. I've spoken with the pharmacist called me. It was really great to talk to her. She works with a lot of my surgeon's patients, and she kind of went over my medicines and how that would work at the hospital. I've talked to the anesthesiologists, and I was told by my surgeon's office that they got my clearance from my primary care doctor. So now I'm just kind of waiting on my appointment in a couple of days to see if any of the stuff that showed up on my echo will impact surgery at all, which I don't think it will. So then I've just been working on kind of getting ready for life after the fusion. Usually I am the type of person who pushes myself a lot and doesn't rest. But this just feels so important. Like, this is my whole life. And I feel very blessed and grateful that I have the ability right now to take the time I need to heal. I had to quit my job because of all of this. I had to put my daughter in full-time daycare. So the surgery's taken, not the surgery, my health has taken a lot from me. And I really want to make sure I'm doing this right. I don't want to push myself and hurt something or, so after surgery, I have all the time in the world to rest and relax and recover and do physical therapy and do all the things that I need to do. I've had some really, really great support from my family. My parents, for a Christmas gift, got us a cleaning service for a couple months after surgery, because I'm the type of person where if I'm sitting here and my house is messy, it's really going to bother me and I'm going to want to go clean it. And I know I need to be taking it easy after surgery. We also got a deep freezer, which is not something that we had. So we have more space now where we're working to try and freeze meals and stuff. I know a lot of that's going to fall on my husband, so I'm hoping we can kind of preload some of those jobs, and so less falls on him after. I'm also trying to get together all the things that I will need post-surgery. My surgeon requested that I buy several kind of medical supplies, like sterile gauze pads, Hibiclens, which is an antiseptic cleaner that I need to start using a couple of days before surgery, and then something called Tecoderm, which I'd never heard of. It's a bandage thing, but they're very expensive, very expensive. I don't know how many I need. I don't know how often they need changed. I don't know any of that, but luckily you can buy them on Amazon. They're just really expensive. So I bought some. I'm probably gonna have to buy more. But anyway, so those are a couple things that my surgeon required that I buy. I also have been looking on support groups and things like that to see what was helpful post-surgery. Main thing I've heard is pillows and ice packs. So I have bought a plethora of pillows. I bought a wedge pillow in case it's hard to get completely straight up or completely flat down. I already had a My Pillow, which I've heard is useful because it has the cotton that you can smush up where you need it. That was a horrible description. I bought a cervical pillow, so it has kind of the dent for your head and then a thing for your neck. And then this one's bizarre, but I've heard for a lot of people actually that squishmallows are really helpful, and I don't think I'm saying that right, but it's a kid's toy. I'll try and put a picture. It's a kid's toy that's a pillow shaped like an animal, but it has this filling where you can also kind of smush it up in the areas you need it. So I figured I would kill two birds with one stone and give it to my daughter as a Christmas present, but she's too short, she'll forget about it, and then I could take it and have it for surgery if I need it. Yeah, and then ice packs are the other thing I heard you really need. So I've gotten several of the gel freezer ones. I heard those are the best, and to take them to the hospital with you because hospital ice packs stink. I also got some relief packs. I showed them in a previous video, but they are great. They don't condensate, so I'm very excited to be able to use all of those for surgery. So I think that's pretty much all I've been doing kind of pre-op wise, other than sitting here. I am feeling like my brace isn't working anymore, which is really unfortunate. I'm bracing my head on other things. I've caught myself like holding my own head up a lot. I'm feeling like my brace isn't making my neck more stable. A couple weeks ago, I did pop something out of place in my lower C-spine. I feel like it's back in place now, but I'm wondering if maybe that is contributing to the instability. I've done several videos on my neck brace and like how it's going, but I was feeling a big difference from it, not just in terms of stability, but it was taking away some of my other neurological symptoms like numbness and tingling. But I've noticed recently I've been feeling numb and tingling and I can't feel parts of my body again. So that's kind of frustrating because it's only been like 5 or 6 months in the brace. And I was feeling very optimistic that if we were kind of using the brace as a trial run for surgery, there were clear improvements. But if it stopped working after like 6 months, like is the fusion going to stop working after 6 months? So yeah, feeling kind of bummed that this is not helping so much anymore. I'm also, because it feels like my head's so heavy, I'm having to like lay down most of the time. So yeah, it's kind of feeling like a bummer. Overall, feelings before surgery, I'm excited for it, if that's an appropriate term. I'm trying to be very optimistic, but I'm also trying to be realistic about how much pain I will probably be in post-surgery. I'm not as much worried about the physical pain because I think I'm pretty good at managing physical pain. I've heard a lot of people are very nauseous post-fusion, whether it's from like anesthesia or the drugs or whatever, and I'm nauseous all the time and I hate being nauseous and I stink at being nauseous. I'm a big baby when it comes to being nauseous. So I'm really worried about that, which seems so dumb to worry about. I'm also a bit worried about not my physical pain afterwards, but like more my mental health afterwards. Because this is like a long recovery journey. I know I'll be in a lot of pain. I won't be able to like pick up my daughter. I won't be able to help around the house. I'll pretty much just be laying here. So I'm worried about kind of spiraling after. Like I said, I'm good at physical pain. Mental health, I've never really had problems in that area, and so it's not something I know how to combat as well as I do physical pain. So I think it's good that I am realizing these different areas that I could struggle with afterwards, so I can manage it better when it comes, if it comes. So yeah, I'm just trying to stay off of Google, stay off of Facebook support groups. I'm trying to stop hearing stories about people's fusions. I know some people have a lot of success. I know others have no success, and I know others are worse afterwards. So I am aware of all the options. I have weighed the cost-benefit analysis and made my decision to move forward with this plan. So I just need to be confident in that and pray that this is the right path, and let myself rest and recover. So this will probably be my last video for a while. I'm not really feeling the motivation or the energy to produce content anymore. I will be like filming stuff pre-surgery, after surgery, during my recovery. I just think it'll be a while before I feel like editing videos. I don't know, maybe I'll feel great. But thanks for coming on this journey with me so far. I certainly will put out the good, the bad, and the ugly of the fusion surgery. But I wish you all a happy holiday season, and I'll see you post-surgery.